Health Secretary Matt Hancock, who joins us now. Good morning to you. Thanks for joining us this morning.
Good morning. How are you?
Good, thank you. Now, we were just talking to Dr. Hillary there about face masks. We know that you've had the advice this week from SAGE, from the advisory group who've been meeting to discuss this. Do you have their advice? What's happening with what you're going to be telling members of the public as to whether they should be using face masks?
Well, we constantly update and follow the scientific advice as the scientists learn more about the virus, as all of us learn more about the virus. But the position hasn't changed. The formal government advice, the government position hasn't changed. And masks, exactly as Dr. Hillary just said there, masks are most important in the NHS and in social care, where people are in close contact, and that's where the masks go. We'll update the government position as and when the advice changes.
But will you be advising people who are out and about, say in a situation in a shop, to use a face mask?
Well, in the case of people who work in shops, many do sometimes wear face masks, but the current advice is that socially distancing is better and has more of an impact, and people should follow the advice from Public Health England, and there isn't any change to that advice on face masks, but we do, exactly as you say, keep the scientific advice under review all of the time.
OK, let's talk a little bit about the Prime Minister, Boris Johnson. We understand that he's feeling considerably better day by day, and there is an expectation that he could well be returning to work next week. Have you spoken to Boris Johnson?
Yes, I spoke to the Prime Minister yesterday, and he's definitely in good spirits, and he's getting much better, and so that's very good news. And I think the whole country looks forward to him coming out of his isolation.
Undoubtedly. There's a lot of our viewers are saying it'd be good to have him back at the helm. He's been missed. Is there a little bit of pressure on him, though, now, Mr Hancock, to come back sooner than maybe he's ready? You've been through this. You experienced it. Admittedly, you didn't have the extreme experience that he did, but you know how long it takes to come back from your experience. Are you sort of conscious that the pressure for Boris Johnson to come back and take over that helm again could be sort of forcing him out of recovery too soon?
Well, I hope not. I mean, by his nature, he's an extremely enthusiastic and hardworking guy, and he doesn't like slouching. So he's, that's his nature. And of course, this is an unprecedented crisis. However, having said that, he's followed his doctor's advice, and it's down to a conversation between the Prime Minister and his doctors as to exactly when he comes back. That's not something that even as the Health Secretary I would get involved in. But the good news is that he's clearly on the mend, very much on the mend. Yeah. He's spoken to the President of the United States. He's spoken to Her Majesty, and he's been talking to those of us in cabinet who are involved in the response. I
wonder if you've spoken to Nicola Sturgeon as well, because of course yesterday she set out a 26-page plan of the lifting of restrictions, and there's some feeling that actually the UK government is waiting for Boris Johnson to come back so he can be at the helm of giving us some sort of insight in what those lifting of restrictions might look like. Is that as you understand it?
Not really, because we've set out the 5 tests that we need to meet before we safely can make any changes to the social distancing rules. They were set out last Thursday. The Scottish document, it follows those principles, and it is too soon to make any changes.
Is it too soon for us to have a grown-up conversation? Because that's exactly how she described it for her voters.
Well, she was following the principles that we'd laid out a week before, and I think it's good that the whole UK has been moving together, and we've set out those principles. Nicola Sturgeon has responded and following, in line with those principles. But the truth is, I know that some people are looking in this space, but the truth is, it is too soon to make changes to the social distancing rules safely. So people should follow the social distancing rules because that is what is needed to keep this virus under control. It now looks like we are at the peak and the curve has flattened, but it wouldn't take much to lose that grip that we've got on it. And that's why we're being very cautious in this space, because it is really, really important that people follow those rules.
And we need to talk to you about testing, because you've got this deadline by the end of the month to get to 100,000 tests a day. That's only 6 days away. But when we look at the numbers at the moment, the total testing capacity a daily is just above 50,000. The number of tests that were done yesterday, 23,560. And yet we know that there's a lower number for the actual tests the actual number of people that are being tested. So how on earth are you going to get to the situation in 6 days' time where you are able to carry out 100,000 tests a day?
Well, the capacity to test is actually above target. As you say, 51,000 capacity, and that's been going up by about 10,000 a day. And the plan was always to build the capacity, build the systems, and then ramp up the capacity. And then exactly as you say, the question is how we then ensure that people can get access to that capacity. And so far, that's been done through your employer. First, it's for patients and for residents in care homes, first and foremost. But then if you're a key worker, getting it through your employer. As of this morning, we have launched a direct booking system on the gov.uk website, a bit like booking a plane or booking a, remember when we used to fly, or booking a hotel. You can now, if you're an essential worker, which is broadly the same definition as those who are going to, those who can send their kids to school, that's set out on the website as well, then you can go if you've got symptoms, or if a member of your household has symptoms, and so you're isolating because of that, you can go and book yourself a test.
Are you confident, Mr. Hancock, that sudden surge of people, because you're talking about key workers and their family members, which is about 10 million people, all of a sudden, that the infrastructure on that website is going to be able to cope? Because as Charlotte's pointing out, you've got capacity for 55,000 tests to be taken, but actually only 22,000 are happening. There's going to be a huge surge all of a sudden. And let's face it, the infrastructure so far hasn't coped particularly well.
Well, the infrastructure's coped absolutely fine. It's that there haven't been as many people coming forward as we've had capacity for. So the infrastructure hasn't...
That's because they can't get to the sites. That's because it's too far away. It's because they can't get away from work. That's because the system to get them there hasn't been easy enough for them to follow.
Well, this is why we've put in a new system that people can directly book instead of having to go through their employer. You're precisely right. And then, as with all switch-ons of IT systems, that's always a moment when you're running it, when you concentrate on it very carefully. Shall I put it that way? And that switch-on has gone live this morning. So if you are watching this programme, you have symptoms, or somebody in your household has symptoms of coronavirus, a cough and a temperature, then you can go and book yourself a test. And the point about people not being able to get to the test centres, we are expanding the number. There are 30 now. There's going to go up to 50. But we're also introducing home tests in small numbers at first, and we'll ramp that up so that you can get the test posted to your home. You self-administer it. You follow a video that's on the internet and the instructions on the test. A courier then comes and picks up your test, takes it back to our labs, and you get the result.